Guys, you are with Dr.Shivaam Kesarwaani and we are going to discuss two important topics which are really important regarding your exams as well as some picture MCQs in this session. So the two important topics which I mentioned are mainly the food adulterants as well as the rickettsial diseases. So if you see the food adulterants, so some diseases are caused due to them. So the diseases like endemic ascites is caused due to toxin pyrrolizidine alkaloid, which is present in rattleweed or crotalaria, also known as junjunia, caused when it is mixed with millet seeds. What happens, as the name already suggests, endemic ascites, that is, it causes hepatotoxicity or liver cancer, and thus this pyrrolizidine alkaloid is a hepatotoxic thing causing the endemic ascites. Second, neuroletharism, very popular, also known as letharism, is caused due to toxin BOA, that is beta oxalyl aminoalanine, which is present in Lathyrus sativus and caused when mixed with Bengal gram or red gram, Bengal gram and red gram. So the adulterant is Lathyrus sativus mixed with Bengal gram or red gram. So what happens? It causes basically the weakness of muscle and inability to move the lower limb, basically, or importantly, the gluteal muscles, the buttocks. Okay, so osteoletharism caused by beta aminopropionitrile. So it is BAPN, beta aminopropionitrile. It is caused by a species of Lathyrus, not sativus but odoratus, and when mixed with Bengal gram and red gram. So what it causes? It causes collagen cross-linking deficiency and thus weakness and fragility of connective tissue, basically the skin, bones, blood vessel, etc. Now epidemic dropsy caused by sanguinarine toxin as well as benzophenanthridine alkaloid. Okay, so and the adulterant is argemone mexicana, and you all know it is mixed with mustard oil. What it causes? It causes inhibition of sodium potassium ATPase activity of heart. As a result, it also causes the nephrotic syndrome, edema, proteinuria, and etc. So these four diseases, you now know the toxin as well as the adulterant. So basically they are keen in asking the toxin as well as the adulterants. The second important topic is rickettsial diseases. Without wasting much time in this, but you make my note that it is very important topic and they are going to ask the causative organism or the vector of these diseases. Now the typhus group, that is, they will ask the epidemic typhus or the Brill-Zinsser's disease is caused by Rickettsia prowazekii. Okay, the vector is louse, human body louse is the vector. How you will remember? So there are many rickettsial disease. Try to remember them by imagining them, like correlating and imagining them. So anything you are facing difficulty in learning, try to imagine them, correlating them, make a story in your mind and learn them. Like prowazekii, or something or someone is provoking, but the vector is so lazy, lazy, louse. The vector is so lazy, that is lousy, that it doesn't get provoked. So whenever you heard the name prowazekii, provoking but not working or not getting activated, that is lazy or louse. So Rickettsia prowazekii vector is louse or lazy. So epidemic typhus caused by Rickettsia prowazekii. Murine typhus or endemic, epidemic over. Now endemic typhus caused by Rickettsia typhi, epidemic by Rickettsia prowazekii, endemic by Rickettsia typhi. Scruff typhus, you all know, by Orencia sushugamusi. Body Rocky Mountain spotted fever or Brazilian spotted fever by Rickettsia rickettsii, and the vector is tick. Now some other like rickettsial pox caused by Akari, Rickettsia akari. Then the other which are asked is Flinders Island spotted fever or thigh tick fever caused by Rickettsia honi. Other is Q fever caused by Coxella bagnati, and one other is Indian tick typhus caused by Rickettsia conori. Rickettsia conori, like you can see here, is causes the Indian tick typhus. Q fever by Coxella bagnati. The last one, that is the trench fever by Bartonella quintana. Bartonella quintana. And Bartonella Hensley causes, you will write in comments what Bartonella Hensley causes. Okay. So over with it, some rapid round picture MCQs just to activate your mind. In the first question, identify the organisms shown in the photograph. So they are mentioning neuraminidase and hemagglutinin. So what it can be? It can be it can be influenza virus. Appearance in the arrow shown in the photograph is caused by, basically they are showing a slap cheek appearance caused by parvovirus B19. Device shown in photograph is used for the protection against, so it is a N95 mask used for H1N1 virus. Incubation period caused by the organisms shown in the photograph is, so you will write the name of the organism in the comment box. The incubation period is 2 to 21 days. It is actually the Ebola virus. Okay. Identify the organism shown in the photograph. Bacteriophages. So basically they will ask you the picture diagrams from some related topics only. So get a hold on the important high yielding topics so that you can also answer these simple picture MCQs, and more focus over the microbiology as well as pathology regarding the pictures MCQ. Anatomy they ask, but not very much MCQs are from anatomy, and the picture MCQ will be such that if one can answer, everyone will be able to answer, and if one cannot answer, then most of the around 70% will not be able to answer that question. So focus over the pathology and microbiology subjects regarding your picture MCQs. And radiology is, they will ask by picture only. So identify the causative organism, the typical cell in the Zinc smear. So Zinc smear you all know. So write in the comments. H and E stain lung tissue with characteristic inclusion bodies indicate. So you can see the owl eye inclusion bodies basically in CMV. Identify the organism in the photograph. Bullet like rabies, you all know. Condition shown in photograph is caused by, so what condition you are seeing? It is condylomata acuminata. Condyloma acuminata. So caused by HPV virus. Diagnose the clinical condition shown in photograph of the blood examination. So it is caused by Epstein-Barr virus. Why, you will write in the comments. So the transmission is shown. You have to write what disease it is, and I will tell you the organism. It is caused by T. verrucosum. Okay. Causative organism of fungal disorder shown in the photograph is, you say. So this answer you will tell. Otherwise I will write in the comment. Lesion shown in the photograph is caused by Tinea barbi. Okay. So the bean beard, there is tinea infection. Preparation shown in the photograph is known as KOH mount. Basically a fungal hyphae are shown, which are basically shown by the KOH mount. Identify the fungal sexual spore type in the photograph. So it is a photograph of Basidiospore. Okay. So fungus is also an important topic from microbiology. Do remember to revise the fungus also. So all the very best from you. This is Dr. Shivaam Kesarwaani signing off. Thank you.